type 2 diabetes is not linked to any clinical symptoms, thus making it difficult to diagnose. While severe diabetes often leads to heart attacks, stroke, heart disease, diabetes itself is rarely named as the official cause of death. However, researchers have warned that people diagnosed with the condition during youth have a greater risk of developing complications at early ages, within 15 years of the diagnosis. A trial, funded by the National Institute of Diabetes and Digestive and Kidney Diseases, found that complications arose sooner for those diagnosed with diabetes in their youth. Within 15 years of a type 2 diabetes diagnosis, 60% of participants had at least one diabetes-related complication, and nearly a third had 2 or more complications. The trial consisted of 2 different studies. The first was called the Treatment Options for Type 2 Diabetes in Adolescents and Youth, Today, and the follow-up study, called Today 2. Dr. Barbara Linder, NIDC project scientist, said, "The original Today study showed that youth-onset type 2 diabetes is distinct from adult-onset diabetes. It is both more aggressive and more difficult to control." How to live longer, 5 habits linked to greater life expectancy that's free of cancer by following this unique disease course. Today 2 shows the devastating complications that can develop in what should be the prime of these young people's lives. At the outset of the study, participants were of ages 10 to 17, had been diagnosed with type 2 diabetes for fewer than 2 years, and were overweight. The median age of participants after the Today 2 follow-up was 26 years. The participants were monitored annually for signs of diabetes complications, including heart disease, kidney disease, diabetes foot complications, and other health events. Researchers observed a steady decline in blood glucose control over 15 years, with certain participants at higher likelihood of developing multiple complications over time. Don't miss How to Live Longer, the anti-aging drink that can regulate cholesterol and blood pressure. Tips: Pfizer COVID vaccine, the side effect more common after second dose, CDC finding, Insights Sue Perkins Health, the diagnosis that destroyed her life, and symptoms for you to spot, Insight. They also noted that 67% of participants had high blood pressure, nearly 52% had dyslipidemia, high fat levels in the blood, nearly 55% had kidney disease, 32% had evidence of nerve disease, and 51% had eye disease. The study showed participants who belonged to a minority racial or ethnic group, or who had high blood glucose, high blood pressure and dyslipidemia were at higher risk for developing a complication. Dr. Philip Zeidler, Today 2 study chair, said, "Compared to what we see in adults with type 2 diabetes, the participants in Today 2 developed complications much earlier in their disease course and at a much faster pace over time." This study shows the importance of treating youth-onset type 2 diabetes intensively from the beginning and using all available approaches to control blood glucose and prevent, delay, or aggressively treat developing complications. The first step in the development of type 2 diabetes is prediabetes, which means that the blood sugar level is higher than normal, but not yet high enough to be type 2 diabetes. However, the long-term damage of diabetes, especially to the heart, blood vessels and kidneys, may already be starting. Furthermore, the same factors that increase the risk for developing type 2 diabetes, increase the risk for prediabetes, including high blood pressure, family history of diabetes, and lack of physical fitness. Some lifestyle changes can prevent the onset of prediabetes, and allow better management of type 2 diabetes. According to Healthline, some lifestyle tips that can help reverse prediabetes naturally. include eating a clean diet, lose weight, eating fewer carbohydrates, drinking water, exercising regularly. Symptoms of type 2 diabetes. According to the NHS, symptoms of type 2 diabetes include peeing more than usual, feeling thirsty all the time, feeling very tired, losing weight, itching around the penis or vagina, or repeatedly getting thrush cuts or wounds taking longer to heal, the health body said. A GP can diagnose diabetes. You'll need to do a blood test, which you may have to go to your local health center for. The earlier the diabetes is diagnosed and treatment started, the better. Early treatment reduces your risk of other health problems. Related articles: high blood pressure, the popular fruit that can raise your readings. Sue Perkins' health, the diagnosis that destroyed her life. Cholesterol symptoms, the signs of high cholesterol on face,